Mr. Chairman, I appreciate it very much. I want to specifically thank Chair Rogers for including two of my bills, the Gabriella Miller Kids Bill with Representative Dingle and a couple others, but also the National Plan to End Parkinson's Act. Thank you very much for including them in today's hearing. The Gabriella Miller Kids First Research Act 2.0, H.R. 3391, is legislation I co-lead again with Representative Wexton as well, and of course Representative Tom Cole. And it would authorize the important pediatric research initiative at the National Institutes of Health, NIH. Sadly, cancer is the single leading cause of death of children in the United States of any disease, approaching 10,000 diagnosed annually under the age of 15. We still have a long way to go to improve survival for our most vulnerable patients, our children who are diagnosed with brain tumors, prevalent cancers, and other pediatric rare conditions. We must continue to allow this program to conduct the critical research needed to improve outcomes and accelerate treatments and cures. My other bill is H.R. 2365, the National Plan to End Parkinson's Act, that I lead with Representative Tonko. And it would unite the federal government through an advisory council of public and private stakeholders in a national effort and strategy to support research, development, recommendations with the goal of treating and curing Parkinson's disease. So I have a question for Mr. Menahan, and I'll tell you what, you did an outstanding job, sir. Thanks for sharing your story. We really appreciate it very much. It makes a big difference when you hear the personal stories. Thank you again for sharing your short story. Your advocacy is extremely impactful, and I greatly appreciate you sharing it. You have highlighted the burden that this disease has on the patient and the families, physically, emotionally, and financially. I personally understand this. My uncle died from Parkinson's, late 50s. My brother just passed away just over a month ago, and Parkinson's. He was diagnosed in his mid-40s. My father has Parkinson's early stages, and my mother-in-law mid to late stages. So I understand the disease, even though I'm not a physician. So again, the lack of treatment options leave patients, families, and the American taxpayers in a terrible predicament with little place to turn, as you said. Could you please elaborate on why this legislation is so vitally important right now? Time is of the essence.
Yes, sir. I am excited about the national plan because for the first time, it's going to give the federal government and stakeholders a chance to sit down and talk face to face. There's going to be a seat at the table where it hasn't been before for patients, caregivers, Parkinson's specialists and doctors. And I think without a mandate, it's not going to happen. And we need this plan because I fear that if we don't do something this year or next year, the problem is going to be that we will not come up with a cure for Parkinson in years, which I hope, versus decades.
Thank you. And I want to also commend Michael J. Fox, obviously,
Yes.
what he's done, his foundation, what he's done to find treatments and potential cures for this disease, and I know they're behind this legislation as well. So he has been extraordinary. There's no question. I've talked extensively about the need to ensure we are coordinating federal efforts. That's the key, coordination, rather than a duplicative and siloed approach to healthcare. And initiatives like Operation Warp Speed prove that with the right public-private partnership, we can accomplish a significant amount. So again, Mr. Menahan, what will the creation of an advisory council mean for coordinated and comprehensive public and private research?
Well, I look at the biomarker, which I had mentioned earlier today, as the hope for the future. But this legislation is a hope for the people that have the disease right now. It's going to bring together the Michael J. Fox Foundation and the private foundations and the federal government. In fact, I talked to someone who served on the advisory board for Alzheimer's. And one of the things she said to me was that this national plan really worked out well because the federal agencies got a lot of opportunity to find out what they're doing. So it's just not the federal agencies and the private foundations talking, it's actually federal agencies talking amongst themselves.
Yeah, and this piece of legislation is modeled after that piece of legislation.
Yes, sir.
To cure
Sure is.
Parkinson's, Alzheimer's in this case.
Correct.
Thank you very much, and I really appreciate it. I have a couple more questions, but I'm not going to go too far over. So I appreciate it, and I yield back, Mr. Chairman.
Gentleman yields back. I now recognize Ms. Custer.